All right. So for a bit of good news now, back to my home state of Wisconsin. Well, I still live in Wisconsin, so anyway. Uh the title of this article is weird. Anti-abortion Wisconsin lawmakers now eye Medicaid expansion, which sounds wonderful. I don't know why they thought this was a good idea, but whatever people are, whatever made them do that is great. Okay, so the article begins. Low-income Wisconsin mothers could stay on Medicaid longer after giving birth and with less paperwork under a bill that has gained bipartisan support in the Republican-controlled legislature. Nearly half of the state's lawmakers have co-sponsored the bill that came before the Senate Insurance Committee for a hearing on Wednesday, which was this past Wednesday. Currently, Wisconsinites can enroll in the state-supported and federally funded healthcare program if they are pregnant and qualify as low income, but have to recertify for the program 60 days after giving birth. Under the proposal, they could keep coverage for a year even if their household income increases, which is awesome. That is great. That tells me that at some level, Republicans understand that one of the reasons people opt for abortion is because they literally cannot afford to have a baby. Whether it be your first one or your second one, doesn't matter. They understand that income has something to do with it. So that's great. Democrats have long supported Medicare expansion in Wisconsin, and Democratic Governor Tony Evers is likely to support the measure, which is similar Medicaid expansion in his budget proposal last month. In areas of disagreement with Republican lawmakers, Evers has issued a record number of vetoes. Oh, good God, who wrote this? Someone needs an English lesson. Yay. All right, a similar bill failed to pass the Wisconsin legislature in 2021, and Republicans rejected Evers' request in the last budget cycle to establish 1 year of postpartum Medicaid benefits, opting instead to extend them to 90 days. The State Department of Health Services is still waiting on federal approval for that extension. So it's still not telling me what made Republicans change their minds. But Republican lawmakers across the country are moving to expand access to postpartum health care after the Supreme Court overturned the constitutional right to an abortion last June. They say the efforts are central to conservative anti-abortion platforms, but in many states, including Wisconsin, Republicans have long opposed efforts to expand Medicaid. So, yes. Now, should they be poking their nose in a woman's right to choose? Absolutely not. But if their anti-abortion stance leads them to doing some good, like this bill, I'm not going to complain that much. Yes, in a perfect world, they'd be doing this because it's just simply the right thing to do, regardless of how they feel about abortion. But hey, I'll take it. Just like they recently introduced a bill for um for exceptions to the total abortion ban, which is for rape, incest, and life of the mother. Now, again, I would rather that they just stayed out of the business of telling people what sort of health care they should have. But At least they're allowing for exceptions, so that's an improvement. So, I am proudly pro-life, and this bill should be part of a pro-life package, said Republican Representative Donna Rosar, the bill's sponsor in the Assembly. The best way to have healthy babies is to have healthy mothers. I can't believe it took this long for any Republican to actually figure that one out. Granted, it is a woman saying this. So you would think that a woman would understand this because, well, it affects her. But really, it's taken you this long to realize that you don't just want to pop out kids, you want them to be healthy. But, again, at least they're doing the right thing. Maybe for the wrong reasons, but this is truly pro-life. Because you're not just saying we just want women to pop out kids. We want these kids to have a healthy start. We want healthy citizens, not just citizens. We want quantity. We want quality, not just quantity. So that's great. I'm not going to bitch too much about this bill. Again, yes, I would rather that they were doing this because, it was the right thing to do and not because it's pro-life. But hey, I'm not going to rag too much on this bill. All right, roughly, what the hell is that supposed to be? It's supposed to be a percentage of births, but I cannot read that. Is that supposed to be a 10? A 1 with a plus sign? What is that? All right. Is that supposed to be 40%? And they just... Yep. Roughly 40% of births are eligible for Medicaid coverage, and states are required to offer eligible mothers at least 2 months of taxpayer-funded coverage. 30 states, including the District of Columbia, have already expanded coverage to 12 months for new mothers, and 8 states have plans to implement 12-month expansions, according to the nonprofit Kaiser Family Foundation, which researches healthcare issues. Again, love that they're finally doing Medicare expansion. Well, they're introducing the bill. I hope it passes because these families need that. And one of the reasons that, like I mentioned before, that women might opt for an abortion is because they just can't afford to be pregnant. They cannot financially afford it. So this should bring down abortions. Now, granted, in our state we have an abortion ban, but this should decrease the amount of women who are trying to go out of state to get an abortion, because for those who are just doing it for financial reasons, this is great. The Wisconsin measure is backed by medical groups including the Children's Hospital of Wisconsin and the Wisconsin Medical Society, as well as anti-abortion groups such as the Wisconsin Right to Life and Pro-Life Wisconsin. And I keep breaking into hives whenever I read that. Ugh. Roughly 50 to 60 Wisconsin mothers die each year after childbirth. Dr. Jasmine Zapata, a chief medical officer of the health department, told lawmakers on Wednesday. What is with leaving out words? This isn't frickin' Twitter. This is not something that I would wish on anyone else, and when you are in that situation, even one life is too many. Nobody attending the hearing spoke in opposition to the bill. That's a good sign. The proposed expansion would cost the state more than $21 million and extend coverage to nearly 5,300 more mothers, according to health department estimates. That's great. Wisconsin remains just Wisconsin remains one of just 10 states that have not accepted federal funds to expand Medicaid eligibility above the federal poverty line, despite pushes from Evers and other Democrats to do so. If Wisconsin were to accept the federal Medicaid expansion, the cost of expanded coverage for new mothers would drop to around $17 million, according to health department estimates. Now, my only question about this is that Medicaid expansion only for pregnant women? Because I could think of a lot of people who could benefit from Medicaid expansion. It shouldn't just be because you're starting a family and you're low income. I think across the board, there should be Medicaid expansion because we have single women who may or may not want to have a family, get married, have kids, whatever. And same thing with single men. They don't necessarily want to do this, but they could use the help. They could use Medicaid. So I would like across the board expansion, not just specifically women, pregnant women, but hey, it's correcting a wrong that of the previous law where women are kicked off way too quickly after giving birth, because I'm not sure how people think that they're going to magically have more income in that month, 2 months after giving birth. So it's still better. I'm not going to, like I said, I'm not going to criticize the bill too much, because this is a good thing. This is across the board a good thing, regardless of the motivations that the Republicans have for this. If it takes the fear of women having abortions to get Republicans to do the right thing, I'm not going to complain. Yes, I would rather that they were doing this because they actually gave a damn about the mother, rather than the fetus that she's carrying. But hey, like I said, this is an awesome development, and I haven't heard anything since, so I don't know what the status of this bill is, but hopefully things are moving forward. I think that's all I have for this video. Not a lot of ranting because, again, something good is happening. The Republicans are actually doing something good. And I don't know what I'm calling this yet, but with that, I will see you guys next time.